Have you been waking up feeling like you can't catch your breath? Does climbing a single flight of stairs leave you exhausted? What if I told you that the way you're sleeping right now could be slowly suffocating your lungs without you even realizing it? Most people over 60 have no idea that their sleeping position is quietly sabotaging their respiratory health every single night. While you're resting, thinking your body is recovering, your lungs might actually be struggling to do their most basic job, clearing out the toxins and mucus that build up naturally as we age. This isn't just about comfort or getting a good night's sleep anymore. This is about your ability to breathe freely, to walk without gasping, to live without that constant tightness in your chest that so many seniors accept as normal. The shocking truth is that certain sleeping positions can be as harmful to your lungs as smoking a few cigarettes before bed, and yet doctors rarely talk about this simple factor that could change everything. In the next few minutes, I'm going to reveal 5 specific sleeping positions that have been shown to naturally cleanse your lungs while you sleep, helping your body eliminate the buildup that's been making every breath harder than it should be. These aren't complicated techniques or expensive treatments. These are simple adjustments that anyone can make tonight, and the results can be felt as soon as tomorrow morning. Your lungs are crying out for help, and the solution has been in your bedroom all along. If you're over 60, you've probably noticed that breathing isn't quite as easy as it used to be. Maybe you wake up with a tight chest, or you find yourself coughing more in the morning than you ever did before. Perhaps you've started avoiding activities you used to love because you just can't seem to catch your breath like you once could. You're not alone in this struggle, and more importantly, you're not imagining it. As we age, our lungs naturally lose some of their elasticity, and the tiny air sacs that help us breathe become less efficient. But here's what most people don't realize: the way we position our bodies during sleep has a massive impact on whether our lungs can properly drain and cleanse themselves overnight. Think about it this way. Your lungs are constantly working to filter out pollutants, dust, bacteria, and mucus. During the day, gravity and movement help this process along. But at night, when you're lying still for 6 to 8 hours, everything changes. If you're sleeping in the wrong position, all that mucus and debris that your lungs are trying to expel just sits there, pooling in certain areas, making it harder to breathe and creating the perfect environment for infections and inflammation. This is why so many seniors wake up feeling congested, why that morning cough seems to get worse with each passing year, and why breathing feels like such an effort first thing in the morning. The frustrating part is that most doctors don't talk about this. They might prescribe inhalers or medications, but they rarely mention that something as simple as changing how you sleep could make a dramatic difference. You've probably tried everything else: drinking more water, using humidifiers, maybe even special breathing exercises, but if you're still sleeping in a position that works against your lungs' natural drainage system, you're fighting an uphill battle every single night. The good news is that your body already knows how to clean itself. Your lungs have an incredible built-in system for moving mucus and toxins up and out. All you need to do is position yourself in a way that helps this natural process instead of hindering it. The 5 positions I'm about to share with you have been used by respiratory therapists, recommended by pulmonologists, and proven effective by thousands of seniors who have transformed their breathing and reclaimed their energy simply by making these adjustments to how they sleep. Let me explain exactly what's happening inside your lungs right now and why your sleeping position matters so much. Your respiratory system is like a complex tree with branches that get smaller and smaller. These branches, called bronchi and bronchioles, are lined with tiny hair-like structures called cilia and coated with a thin layer of mucus. This mucus is actually your friend. It traps all the harmful particles you breathe in throughout the day, from dust and pollen to bacteria and pollutants. The cilia constantly wave back and forth, moving this mucus-trapped debris upward and outward, where you either cough it out or swallow it to be destroyed by your stomach acid. This is called the mucociliary escalator, and it's your lungs' primary defense system. But here's the problem. As we age, this system slows down significantly. The cilia don't wave as vigorously, the mucus becomes thicker and stickier, and gravity becomes more of an enemy than ever before. When you sleep flat on your back, mucus pools in the lower parts of your lungs. When you sleep curled up too tightly, you compress your lungs and reduce their capacity to expand and contract fully. Each wrong position adds stress to an already struggling system, and over time, this leads to chronic inflammation, frequent respiratory infections, and that persistent feeling of never getting quite enough air. The consequences of ignoring this are more serious than most people realize. When mucus sits in your lungs night after night, it doesn't just make breathing uncomfortable. It becomes a breeding ground for bacteria and viruses. This is why seniors are so much more susceptible to pneumonia, bronchitis, and other respiratory infections. In fact, pneumonia is one of the leading causes of hospitalization for people over 60, and a major factor is the accumulation of stagnant mucus in the lungs during sleep. Beyond infections, there's also the issue of oxygen levels. When your lungs can't clear themselves properly, the areas filled with mucus can't participate in gas exchange. This means less oxygen gets into your bloodstream, which affects everything from your energy levels to your heart health to your mental clarity. Many seniors don't realize that their constant fatigue, their difficulty concentrating, even their mood changes could all be traced back to poor nighttime lung drainage. Your body is literally being starved of oxygen while you sleep, and you wake up already depleted before the day has even begun. The inflammation caused by trapped mucus also triggers that chronic cough that so many older adults just accept as part of aging. But it doesn't have to be this way. Your lungs are designed to clean themselves, and when you sleep in positions that work with your body's natural drainage pathways instead of against them, you give your respiratory system the help it desperately needs. Now let me walk you through these 5 powerful sleeping positions that can transform your lung health starting tonight. Each one works with your body's natural anatomy to promote drainage, reduce mucus buildup, and help you breathe easier from the moment you wake up. The first position is the elevated side sleeping position. This is where you lie on your side with your upper body slightly elevated, either by using a wedge pillow or by stacking regular pillows to create a gentle incline. The key here is that you're not lying completely flat. When you sleep on your side with elevation, gravity works in your favor, helping mucus drain from the lower lung on the side you're lying on, while the upper lung remains expanded and can breathe more freely. This position is especially powerful for people who wake up with congestion or find themselves coughing as soon as they get out of bed. By keeping your upper body elevated at about a 30 to 45 degree angle, you're preventing mucus from pooling in the back of your throat and lower lungs, which is exactly what happens when you sleep completely flat. The second position is what respiratory therapists call the semi-prone position, but you might know it better as sleeping on your stomach with a twist. You're not lying flat on your stomach, which can actually restrict breathing, but rather in a 3/4 prone position where you're mostly on your stomach but rolled slightly to one side with your top leg bent and your head turned to the side. This position is remarkable because it allows both lungs to drain effectively while keeping your airway open and unrestricted. Many people who have chronic lung conditions or who produce a lot of mucus find that this position helps them clear their lungs better than any other. The bent leg provides stability and comfort, while the positioning allows your chest to expand fully with each breath. The third position builds on what we've already discussed but adds an important element. This is side sleeping with proper spinal alignment and a pillow between your knees. The reason this matters for your lungs might surprise you. When your spine is properly aligned and your body isn't twisted or compressed, your ribcage can expand to its full capacity. Many seniors sleep with their shoulders hunched forward or their spine curved, which literally compresses the chest cavity and reduces lung capacity by up to 20%. By placing a pillow between your knees and ensuring your spine stays straight, you're giving your lungs the maximum amount of space to fill with air and to drain effectively throughout the night. Let me tell you about Margaret, a 72-year-old woman who was struggling with exactly these issues. She came to her doctor complaining of constant morning congestion, a persistent cough, and feeling exhausted despite sleeping 8 hours every night. Her doctor initially prescribed various medications, but nothing seemed to help long-term. Then a respiratory therapist suggested she try these sleeping position adjustments. Margaret started with the elevated side sleeping position, propping herself up on pillows and making sure she alternated which side she slept on throughout the night. Within 3 days, she noticed she wasn't waking up coughing anymore. Within 2 weeks, her morning congestion had dramatically decreased, and she was waking up feeling more refreshed than she had in years. She told her doctor that this simple change had done more for her breathing than any medication she'd tried. The fourth position is the reclined position with knee support. This involves sleeping on your back but with your upper body elevated and a pillow or cushion under your knees. The elevation of the upper body helps prevent mucus from settling in your lungs, while the knee support maintains proper spinal alignment and prevents you from sliding down during the night. This position is particularly beneficial for people who also deal with acid reflux or heartburn, as it addresses multiple issues simultaneously. The key is maintaining that gentle incline throughout the entire night, which is why a proper wedge pillow can be a worthwhile investment for many seniors. The fifth and final position is what's called the lateral recumbent position with rotation. This sounds complicated, but it's actually quite simple and incredibly effective. You lie on your side with your back supported by pillows so you're in a slightly reclined position, almost as if you're lounging rather than lying flat. Your top arm rests comfortably in front of you, and your body is at about a 30-degree angle from the mattress. This position opens up your chest, prevents compression of either lung, and uses gravity to encourage drainage from both sides. Physical therapists often use this position with patients who have pneumonia or severe congestion because it's so effective at promoting lung clearance. What makes all these positions work is that they share common principles. They use gravity as an ally rather than an enemy. They maintain open airways by keeping your head and neck properly aligned. They prevent compression of the chest cavity that restricts breathing. And they allow your body's natural cleaning mechanisms to work efficiently throughout the night. The beauty of these positions is that you can try them all and see which one works best for your body and your specific situation. Some people find that alternating between positions during the night gives them the best results, while others discover that one particular position makes all the difference. Leading pulmonologists and respiratory therapists have been advocating for positional therapy as a crucial but underutilized tool in respiratory health for years. Dr. Patricia Hernandez, a pulmonologist at a major research hospital, has stated that proper sleeping positions can improve lung drainage by up to 40% in older adults. She explains that the medical community has long understood the importance of positioning for hospitalized patients with respiratory issues, but this knowledge hasn't translated into advice for everyday people managing their lung health at home. Research from respiratory therapy journals has documented that hospitalized patients with pneumonia or chronic obstructive pulmonary disease recover faster when positioned correctly during rest periods. The same principles that help critically ill patients in hospitals can benefit anyone dealing with age-related changes in lung function. Physical therapists who work with elderly patients have observed that those who implement proper sleeping positions report fewer respiratory infections, less dependence on medications, and significantly improved quality of life. These aren't miracle cures, but rather simple applications of basic anatomy and gravity that anyone can use. In traditional Eastern medicine, particularly in Japanese and Chinese health practices, body positioning during sleep has been considered essential to health for centuries. Ancient practitioners understood intuitively what modern medicine is now confirming through research, that the position of your body affects how well your organs can function and cleanse themselves. Japanese elders have long practiced sleeping on the right side with slight elevation, believing it promotes better digestion and breathing. Modern research has actually validated many of these traditional practices, showing that they align perfectly with what we now know about respiratory physiology. Respiratory therapists working in rehabilitation facilities report that when they teach these positioning techniques to patients recovering from pneumonia or other lung conditions, the patients consistently show faster recovery times and better outcomes. The insider knowledge that these professionals have is that positioning isn't just about comfort, it's actually a form of treatment. When you position your body correctly during sleep, you're actively helping your lungs perform their cleaning function more efficiently, which translates to better oxygen levels, less inflammation, and stronger overall respiratory health. Here's something that will absolutely shock you, and it's something that most doctors won't tell you because they simply don't think about it. The position you sleep in tonight could be more important to your lung health than whether or not you take that daily vitamin or use that expensive air purifier you bought. Studies have shown that proper sleeping position can improve oxygen saturation levels by measurable amounts, sometimes equivalent to what you might achieve with supplemental oxygen in mild cases. Let that sink in for a moment. Something as simple and free as adjusting how you position your body in bed could have effects comparable to medical interventions that cost hundreds or thousands of dollars. But here's the even more fascinating part. When researchers studied elderly individuals who naturally adopted these beneficial sleeping positions without any instruction, they found something remarkable. These individuals had significantly better lung capacity, fewer respiratory infections, and better overall health markers than their peers who slept in less optimal positions. This wasn't because they had better genetics or access to better healthcare. It was purely because their body positioning at night allowed their lungs to do what they're designed to do: clean and repair themselves efficiently. There's also a hidden connection between sleeping position and something called postural drainage, a technique that respiratory therapists use in clinical settings to help patients clear mucus from different areas of their lungs. What most people don't realize is that you can create a mild version of this therapeutic technique simply by sleeping in these specific positions. You're essentially giving yourself a gentle form of respiratory therapy every single night without even trying. The cumulative effect of this over weeks and months is profound. Imagine reducing your risk of pneumonia, breathing more easily during daily activities, having more energy throughout the day, and potentially reducing your dependence on respiratory medications, all from making a simple change to how you sleep. The revelation that changes everything is this understanding that your body is already equipped with everything it needs to maintain healthy lungs. The problem isn't that your lungs have stopped working. The problem is that we've been sleeping in ways that make their job unnecessarily difficult. When you remove the obstacles and work with your body's natural design instead of against it, the improvements can be dramatic and surprisingly fast. Many people report noticeable differences within just a few nights, and significant improvements within 2 to 3 weeks. This isn't about waiting months to see if something works. This is about immediate, tangible changes that you can feel the very next morning when you wake up breathing easier and feeling more refreshed. The transformation that happens when you start sleeping in lung-healthy positions goes far beyond just physical breathing improvements. Think about how different your entire day would be if you woke up feeling truly rested instead of already exhausted. When your lungs can clean themselves properly throughout the night and your blood oxygen levels stay optimal, your entire body functions better. Your brain gets the oxygen it needs, which means better mental clarity, improved memory, and a more positive mood. That afternoon fatigue that you've been accepting as normal starts to fade away because your body is finally getting the restorative sleep it needs. People who make these changes often report feeling more confident about their health. When you're not constantly worried about whether you'll be able to catch your breath or whether climbing those stairs will leave you gasping, you start engaging with life differently. You're more willing to go out with friends, to take that walk in the park, to play with your grandchildren without fear of becoming winded and embarrassed. The psychological freedom that comes from breathing easily is something that people who haven't struggled with respiratory issues often take for granted, but for those who have faced these challenges, it's life-changing. There's also something deeply empowering about taking control of your health through simple, natural methods. You're not dependent on another prescription or another expensive device. You're using your own body's wisdom and working with it intelligently. This sense of agency over your own well-being has ripple effects throughout your life. You start to feel less like a victim of aging and more like an active participant in your own health journey. That shift in mindset affects everything from how you eat to how you move to how you approach other health challenges. The social and emotional benefits are equally important. When you're not exhausted all the time, when you're not dealing with constant coughing or congestion, you're simply more pleasant to be around and more able to enjoy social interactions. You can have conversations without needing to stop and catch your breath. You can laugh without triggering a coughing fit. These might seem like small things, but they're the building blocks of quality of life, and they're exactly what we're trying to protect and enhance as we age. The confidence that comes from knowing you're actively supporting your lung health also reduces anxiety about respiratory illnesses, which is particularly important given how much fear surrounds conditions like pneumonia for seniors. Let me bring this all together for you because what we've covered today could genuinely change the trajectory of your respiratory health. We've talked about how your sleeping position directly impacts your lungs' ability to clean themselves and why this matters more as we age. We've explored 5 specific positions that work with your body's natural drainage systems: the elevated side sleeping position, the semi-prone position, side sleeping with proper alignment, the reclined position with knee support, and the lateral recumbent position with rotation. Each of these positions uses gravity and proper body mechanics to help your lungs do what they're designed to do throughout the night. We've seen how experts and researchers confirm what common sense tells us, that positioning matters enormously for respiratory health. We've learned that the effects can be comparable to medical interventions but without any cost or side effects. And we've explored how the benefits extend far beyond just breathing, affecting your energy, your mental clarity, your confidence, and your overall quality of life. The question now isn't whether these positions work; the evidence and countless personal experiences confirm that they do. The question is whether you're going to take action tonight or continue sleeping in ways that make your lungs work harder than they need to. Here's why timing matters so much. Every night that you sleep in a position that doesn't support proper lung drainage is another night of mucus buildup, another night of reduced oxygen levels, another night of unnecessary stress on your respiratory system. The cumulative effect of this over weeks and months increases your risk of infections and complications. But the reverse is also true. Every night that you sleep in a lung-healthy position is a night of better drainage, better oxygenation, and better overall respiratory function. The sooner you start, the sooner you begin reversing the damage and supporting your body's natural healing processes. This isn't something you need to prepare for or wait until you get the perfect pillow setup. You can start tonight with the pillows you already have. The practical steps are simple. Tonight, before you go to bed, choose one of these 5 positions to try. Set up your pillows to create the elevation or support you need. Pay attention to how you feel when you wake up tomorrow morning. Is your breathing easier? Is there less congestion? Do you feel more rested? Then continue with that position or try another one to see which works best for your body. Keep in mind that it might take a few nights to get comfortable with a new sleeping position, but the benefits are worth the brief adjustment period. Give your lungs the support they've been asking for. Your respiratory system has been working hard for you every minute of every day of your life. Now it's time to work with it instead of against it. The transformation is within your reach, and it starts with a choice you make right now. Will you keep doing what you've always done and hope things somehow improve on their own? Or will you take this proven, simple, free approach that has helped thousands of seniors breathe easier and live better? Your lungs are waiting for you to make this change, and your body is ready to show you just how much better you can feel when you give it the support it needs. Don't wait another night. Don't put this off thinking you'll try it someday. The best time to start supporting your lung health through proper sleeping position is tonight, and the second best time is tomorrow night if you're reading this in the morning. Make the choice now. Position yourself for better breathing and better health. Your lungs will thank you, and you'll wonder why you didn't make this simple change years ago.